you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. As of the evening of March 11th, 2020, President Trump has decided that as of this Friday, 2 days from now, we will be banning any incoming travel from Europe for a 30-day period. Today, I want to talk to you guys a little bit about coronavirus. So I know we did an episode a few weeks back on it, but since then, a lot has changed. I know folks are getting really nervous about it in general, and certain areas in specific, like Tampa and Washington and places in California, are particularly bothered by it at this point, as there have been some deaths and associated illnesses within the communities in those areas. So today I want to really take a hard look at the updates from the CDC, as well as reputable sources like Johns Hopkins University, where they are tracking this with ArcGIS, which is a really great mapping program used by a ton of different fields, but I encountered it first in my own academic pursuits in the realm of geography and anthropology. So I've seen this cool program be used for tracking the possible areas that people's remains may be in search and recovery efforts, and you can use it for just about anything. So ArcGIS is currently being used to track global cases with the Centers for Systems Science and Engineering at Johns Hopkins as well. So we're going to talk about some of this data today and what it really means, when to go to the doctor, what's the difference between the flu versus coronavirus or allergies, so that y'all can have a better understanding from factual sources of how to tell the difference between all of these things that are going on right now. So first up, let's check the situation report for coronavirus 2019. I know it's 2020 now, but they identified it in 2019, so they're going to continue calling it COVID-19. So as of today, the CDC has been responding to the outbreak of coronavirus. It is a respiratory disease, and a lot of colds have been caused by coronaviruses in the past. So this isn't just some new single virus that we've never seen before. It's a subset, it's a type of virus, and it's just a new strain of it. So we first detected it in China, and now they found it in more than 100 locations internationally, including the United States. So they have also named it SARS-CoV-2, and the disease it causes has been named Coronavirus Disease 2019, or COVID-19. So the virus itself is called SARS-CoV-2. You guys probably remember SARS from a few years ago. It's a type of virus. So we are just seeing another type of that right now. SARS stands for Severe Acute Respiratory Syndrome, and it first appeared in China in 2002. SARS-CoV-2 is the new one, and we are experiencing that one as coronavirus right now. So on January 30th, 2020, the International Health Regulations Emergency Committee that belongs to the World Health Organization has declared the outbreak a public health emergency of international concern. By March 11th, which is today, the WHO publicly has claimed it is now a pandemic. So we are at pandemic status. That is not ideal, but that's okay. We don't need to necessarily panic. Panicking is not going to help any of us. We need to instead prepare. So let's talk a little bit about the source and spread of this virus. Coronaviruses are a large family of viruses, and they're common in people and other species of animals. Camels can get them, so can cattle, bats, cats. Some animal coronaviruses can infect people, but that's very rare, and then it can spread between people. That is what's kind of going on with this new one, SARS-CoV-2. So this one is called a beta coronavirus. And the SARS-CoV original virus that we originally just called SARS and was in China from 2002 to 2004 is now one of 3 of these viruses that have these origins in bats. So the current one, CoV-2, the original SARS, and MERS-CoV were all from bats originally. The infection sequence in the US and how the patients are handling it is very similar to the way that China was originally dealing with it and reporting it, and it suggests a likely single recent emergence of this virus from an animal reservoir. If you aren't familiar with those epidemiological terms, a reservoir is a component of an infectious agent, so it's the habitat where that infectious agent, like a virus, so in this case, coronavirus, normally lives and grows and multiplies. A reservoir could be humans or another type of animal or the general environment. Reservoirs may or may not be the source from which an agent, like the virus, is transferred to a host, like us humans. Coronavirus is a zoonotic disease. Zoonotic means it comes from other animals, and then we can go ahead and get it. So just like MERS-CoV, and that killed about 30% of the people it infected, and the SARS virus, which killed about 800 people between 2002 and 2004, this coronavirus also comes from bats, and it is, in that way, a zoonotic disease. So that's what they mean by that. According to some University of Pennsylvania experts, something around 60% of known infectious diseases that are currently occurring in people are zoonotic. Recently, they found that 75% of newly emerging infectious diseases, so ones we haven't come across before, like this new coronavirus, are zoonotic as well. So they think that we're either seeing an increase in the relative frequency of how many diseases are spread from these animals, or we're just getting better at identifying them and where they come from. The CDC currently thinks that the original spread occurred with a large seafood and live animal market in China in Wuhan, and that suggested an animal-to-person spread, but the growing number of patients since then seem to indicate a person-to-person spread because the other patients did not have exposure to these animal markets. The person-to-person spread was also reported outside of Hubei province, which is where Wuhan is in China, and in countries outside China, including the US. Some international locations now also have community spread with coronavirus, and so do some parts in the US. Community spread means that some folks have been affected and they don't yet know how or where they became exposed. It's just somewhere in the general community as they've gone about their day-to-day lives. We're going to go on a quick break, and when we come back, we're going to talk a little bit more about how COVID-19 spreads. Stay tuned.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
to the current situation report on coronavirus as it is spreading globally and has now been declared by the World Health Organization to be a pandemic. Now we're going to discuss specifically how it spreads. Right now, according to the CDC, COVID-19 is still a very new disease and we're still learning how it spreads. We're also learning more about the severity of illnesses it may cause and to what extent it may spread in the U.S. So that doesn't mean that we don't know anything about it. It's just that our body of data is growing. And as we acquire more data about this epidemiological issue, just like any other type of science, we will learn more in general, and sometimes new things will come to light. That does not mean that it was bad science before, just that sometimes things change. Viruses and bacteria tend to mutate quicker than humans are able to with our genes. That's why a lot of folks tend to study viruses and bacteria for evolutionary types of research, because you're able to see their different generations at a much faster clip than you can in humans. That's also why we use mice and such. It's not the only reason, but those are some reasons. So, for COVID-19, how is that spreading? So far, we do know that it can spread person to person. That's how we think that it mainly spreads at this point. So, people who are in close contact with one another, so think about within 6 feet. If you are 6 feet tall, I think your arm span is supposed to be about as long as you are tall. So if you're 6 feet tall, that's going to be 6 feet. If you're like me and you are 5'2", or you're very tiny, then you're going to think about adding another 6 inches to the tip of your wingspan. So from the tips of your fingers. So think about that as your personal bubble. I don't want you guys to get aggressive about it or anything like that, but keep that in mind when you're interacting with the general public. I know I have a concert that I was hoping to go to in San Antonio on Sunday night, and I already have tickets for it, but I'm not sure if it's still going to be happening or whether that would be a good idea for me to even attend at this point. My roommate, Roger, works at a hospital, so I may well end up getting it if he gets it, but we're going to, cross our fingers at this point and just wash our hands. Washing our hands is going to do a lot more than crossing our fingers, especially if this is spread through close contact. So avoid close contact with others within that 6-foot bubble if you can, and also frequently wash your hands. In addition to interpersonal contact, it may also be spreading through respiratory droplets, and that means anytime someone who is infected coughs or sneezes, they may be getting those droplets on others. So it's important to make sure you're coughing into your elbow. Make sure you're sneezing into your elbow. Keep that self-contained. We don't want those respiratory droplets spreading absolutely everywhere else. That is why it's important for the folks who are ill to wear the face masks. It's not necessarily going to be all that helpful if you do not have it and you're wearing these face masks, as most of the face masks that people buy are not small enough to really keep these microbes out. But it's going to help contain them and drastically reduce how many are getting out from the people who actually are sick. So can someone spread the virus without being sick? A lot of folks in the case of COVID-19 are thought to be most contagious while they are most symptomatic. So the sicker you are with this, we think that is when you're the most contagious. A lot of folks think that the spread might be possible before people start showing symptoms as well. So that's why it's important for everyone to be conscious of this. Sneeze into your elbow, even if you think it's allergies. Make sure that you are washing your hands frequently and try not to touch your face and go from there. Not touching your face is just a great rule in general because it's also going to help your skin feel a lot better by not putting more bacteria in there and clogging up your pores. Now, with the coronavirus particularly though, there have been reports of some spread occurring with this new coronavirus before people show symptoms, but we don't think that that's the main way the virus is spreading. It's mainly being spread through folks who are quite clearly ill. So, for the spread from contact with contaminated surfaces or objects, Those are often called fomites in epidemiology. It's something that is non-living and is a surface that you can obtain germs from. So think doorknobs, countertops, the waiting room at your doctor's office. It is possible for you to get COVID-19 by touching a surface or any object that has the virus on it. If a person can touch it, you can get it. So be very careful with that. The reason they're telling folks to not touch their faces is because if you happen to touch a surface or object that has the virus on it, and then you touch your mouth, your nose, maybe even your eyes, they haven't determined that yet, but pretty much about anything that has a mucous membrane or an easy entry into the rest of your body with those different types of fluids, then you could be potentially obtaining the virus that way. But they don't think that that is the main way the virus spreads. So you don't need to freak out about fomites right now, but it is just generally a good idea to go ahead and be washing our hands frequently, wash anything we touch frequently. It's pretty variable regarding how easily the virus can spread from person to person. Some viruses are very contagious, like measles, while others don't spread that easily. Another factor is whether the spread is sustained, and that means if it just keeps spreading continually without stopping at all. The virus that causes COVID-19, that SARS-CoV-2, seems to be spreading pretty easily and sustainably in the community. So that is why it's at that pandemic level at this point. So an epidemic means there's been a sudden increase in the amount of cases of a disease above what you would normally expect, given the normal spread of similar diseases. But a pandemic means that it's past epidemic levels, and it's now spread over several countries or continents, and also affecting a large number of people. So when they're throwing these words around, that's what they mean. You don't need to panic in the regard that it's super deadly in that way. That's not what a pandemic means. We have to look for other information regarding how easily it spreads when having that type of discussion. But in regards to how widely it's spreading and how quickly it's spreading, that's really what epidemic and pandemic mean. But it has nothing to do with the actual danger and mortality rates of a specific infectious disease. So in the U.S. right now, we have many health laboratories in addition to the CDC testing for the virus that causes COVID-19. You can go to the CDC's public health lab testing map if you would like from the CDC website, and they are updating these pages regularly at noon Monday through Friday. The numbers close out at 4 p.m. the day before reporting. It doesn't specify whether that is Eastern time, but I'm going to say it likely is, since the CDC is headquartered in Atlanta in the Eastern time zone. So if you check that page, as of the evening of March 11th, we have had 938 total cases of COVID-19 in the U.S. and 29 deaths out of 938 total cases. Jurisdictions reporting the cases were 38 different states and the District of Columbia. That data includes both confirmed and presumptive positive cases that have been reported to the CDC or tested at the CDC since January 21st, 2020, with the exception of testing results for people who have been repatriated to the U.S. from Wuhan, China, and Japan. So anyone who was overseas and obtained this and then came back, they're counting those as having been obtained overseas. Anyone else who has obtained it within the U.S. is counted in these 938 total cases and 29 deaths. State and local public health departments are now testing and publicly reporting their cases. If there's a discrepancy between CDC cases and cases reported by the state and local health public officials, then data reported by the states should be considered to be the most up-to-date. And that just makes sense, right? So you are able to get this information on a local level because it's local folks who are treating these people who are coming in. They're the ones performing the tests. And it takes a little bit of time to get it into the CDC and update those numbers. So the numbers close out at 4 p.m. the day before reporting. So anything that occurs after 4 p.m. on, say, today, Wednesday, is going to be added onto the numbers on Tuesday, because they're going to update that from 4 p.m. the day before at noon on Tuesday. So it's a little bit behind. That's why the local state numbers are going to be more correct. Now, of these cases of COVID-19 reported in the U.S., 92 were travel-related, 75 were close contact, and 771 of them are still under investigation. So those are the community spread. These people aren't sure exactly where they got it from, but a lot of care is being taken to be mindful about cleaning these areas, just in case. Here in San Antonio, about a week or so ago, someone was tested and then went to the North Star Mall, I want to say. And when they went there, they were walking around the mall for a while and then got a call that said that they tested positive. And so they had to shut down the mall and go through and clean everything. The mall has been reopened since then, I believe, but no one's really going to the mall right now. And I understand that people are alarmed. We can't be entirely sure where all these respiratory droplets went, but remember that they don't think that it's primarily spread by foam mites right now, and they did clean the area. So don't go into full panic mode in that regard. As of today, March 11th, there are illnesses that may not yet have been reported that could have began anywhere between March 3rd and March 10th. Remember, it takes a week to 2 weeks to start showing symptoms for this in some cases. So we're getting this data a week to 2 weeks behind as well. And that is not the fault of anyone. You don't know that you're sick until you get sick. That's why it's important to be washing our hands regardless. All right, we're going to go on another quick break. And when we come back, we're going to discuss the CDC's travel recommendations.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
And COVID-19, particularly as it relates to how it's spread and its numbers in the U.S. Now we're going to take a look at the CDC's travel recommendations. So right now they've been updating this very frequently, as we discussed earlier, and they have a general risk assessment by country that you can search. So they have a geographic risk assessment for COVID-19 transmission on the CDC webpage, and they can help you out in figuring out where you should specifically consider avoiding and so on. So it's an interactive map, and you can just click on the areas. The TLDR version of that is that there is widespread sustained, so remember that's ongoing transmission, it's still spreading right now, and restrictions on entry to the United States. The CDC recommends that travelers avoid all non-essential travel to China and to Iran. Those are marked with a level 3 travel health notice. So entry of foreign nationals from those destinations has been suspended. And a level 3 warning means that there's widespread community transmission. So they're not sure exactly where it's coming from, but these people are picking it up. So China is experiencing widespread community transmission of respiratory illness caused by COVID-19. The CDC recommends that you avoid non-essential travel. Older adults and people with chronic medical conditions may be at increased risk for severe disease. Travelers should also avoid coming into contact with sick people and clean their hands often by washing with soap and water for at least 20 seconds. or using an alcohol-based hand sanitizer that has 60% to 95% alcohol. So make sure you are reading those labels. It all comes down to the labels, you guys. Travelers should also stay home for 14 days after returning to the U.S. and practice social distancing. So if you have some essential travel you have to perform, make sure that your boss or anyone else involved knows that you need to stay home for 14 days after you return and love your friends over FaceTime from afar. They will understand and appreciate it in the long run. Any travelers who have a fever, a cough, or respiratory problems should call ahead before seeking medical care. So if you think that you are coming down with a cough or like a cold or the flu, call into your doctor's office first. Don't go to the walk-in clinic necessarily. They may have some questions they can ask you to help you determine what is going on. We also don't want to overflow our medical facilities at this point. It may just be allergies. It may just be a regular flu. We are going to call our doctors first and see what their recommendation is for it. Believe me, if they think that you have it, they will ask you to come in to be screened, but they may want to be sure that they can do so in a controlled manner so that you can't spread that to everyone else who is in that waiting room, who can then go and spread it to the rest of the community. We want to be smart about this in all situations. So what's our current situation? The CDC says that you should not be traveling to China if it's non-essential, but that does not include Hong Kong, Macau, or the island of Taiwan. There's limited access to adequate medical care in affected areas, so again, that's why they want folks to call ahead. Italy and South Korea currently also have level 3 travel health notices as assigned by the CDC, so those are the same parameters that we just discussed for China and Iran. Japan has a level 2 alert. The stages for this travel system are a watch, level 1, so that's practice usual precautions, alert, which is level 2, practice enhanced precautions, and then the warning, which is level 3, avoid non-essential travel. So right now, we have a few countries on the level 3 list. For the level 2 list, that's Japan right now. That means they have a sustained community transmission. And if you're a high-risk traveler, then you should take special precautions at that point. So that means that older adults and those with chronic medical conditions should consider postponing non-essential travel. Travelers should avoid contact with sick people, clean their hands often with that soap and water, preferably, or the alcohol-based hand sanitizer at 60 to 95% alcohol. And also watch your health during travel and for 14 days after returning to the U.S. So the real difference here is that with the warning, you really should not be going at all. If your travel is non-essential, whereas they're like, maybe consider postponing it for level 2. And level 3 is also saying you need to stay home for 14 days after you return to the States. Whereas for level 2, it's just, hey, keep an eye on your health. You can still go in to work, into the office. Level 3, you should be working from home. Hong Kong is at the level 1 watch level, so that's just practice your usual precautions. Don't open a doorknob with your mouth. Make sure that you are washing your hands frequently and making sure that you are not coming into contact with sick people if you can. Remember that wingspan rule, and it being about 6 feet is the bubble you're trying to maintain. For Hong Kong, they don't have anything else going on there because it's just the level 1 watch level. So you don't need to be super conscious about your health when you are returning from that area, and they're not recommending any reconsiderations for travel or anything like that. We are all set for Hong Kong. If you're considering going on a cruise, however, depending on where you're going, perhaps reconsider. You do not know where everyone else has also been, and you want to make sure that you are being safe. I don't want anyone to feel paranoid or anything at this point. Just be mindful about what's going on when you make your decisions. Make smart decisions when it comes to washing your hands, and go from there. You can also read the guidelines for cruises and travel yourself on the CDC website. I'm just giving you guys the highlights as it is right now. We do not have a complete clinical picture for COVID-19 yet. Reported illnesses have ranged from being very mild including some folks who did not have any reported symptoms, but they did have the virus. And other folks had very severe reactions, and we all know that some folks have also died from this so far. A lot of information up to this point suggests that most cases of COVID-19 are mild. A report out of China suggests a serious illness occurs in 16% of cases. Older folks and people of all ages who have underlying health conditions, so heart disease, lung disease, diabetes, if you are undergoing any type of chemo treatments or radiation, or if you are having to get neutrophil patches, so those white blood cell injections, or if you have an autoimmune disorder. The folks who have these issues likely already know they don't need you guys to give them a hard time about it or anything, but these are the folks that we are particularly concerned about at this point. So even if you are not particularly at risk, keep those people in mind, especially if you have someone that you come into contact with who may have those issues. Also keep in mind that a lot of these diseases that are these underlying health conditions are invisible. You can't tell if someone has a compromised immune system from rheumatoid arthritis or from chemo treatments just by looking at them. A lot of folks think that you always know when someone's going through cancer treatments because they go bald. That is not the case. The baldness is going to depend on what specific type of treatment they are going through. You can get many different types of cancer treatments, and not all of them will cause hair loss. Not all of them are going to make your cheeks puffy and be very apparent that you are going through these treatments. So just because someone around you doesn't look sick does not mean that they aren't necessarily sick. People can get these diseases at any age, so be compassionate when you're discussing this in public as well, because a lot of folks around you may be suffering silently with invisible diseases, and hearing folks say things like, oh, well, only the people who have compromised immune systems have to worry about that, can be very upsetting. I know I have people in my personal life who I care a lot about who do have these compromised immune systems, and they still showed up to vote and everything in this election this past week. And when they showed up for Super Tuesday, there were folks in the line saying, oh, well, I'm glad that you don't have to worry about that. And I don't have to worry about that because we're not of a certain age. And, it's just the folks who are of a certain age and have underlying health conditions. And my friend very much does have an underlying health condition and is definitely immune compromised. Just because someone looks healthy to you does not mean that they are not going through their own health struggles. I think it's very important to keep that in mind, not just for physical safety, but also for everyone's mental and emotional wellness. Everyone is struggling on their own and fighting their own battles, and they do not need us to heap more emotional and mental turmoil on them by making these types of comments insensitively. So remember, health and wellness are holistic, and let's keep that in mind as we go through and have these public discussions and private discussions about COVID-19. We're going to go on a quick break, and when we come back, we're going to talk about the risk assessment and the CDC's response. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Severity of COVID-19, as well as the importance of respectfully communicating about this virus. There are folks who are immune compromised and you would not be able to guess it by looking at them any more than you could guess whether they have anxiety or whether they had a traumatic childhood. We're not out here to play these guessing games, so we need to make sure that we just always approach this conversation with respect. So, moving forward, we're going to be discussing a risk assessment for it. So for the risk assessment, we know that it has been declared a pandemic now. So that means it has caused severe illness, including illness resulting in death. It has been shown to have sustained person-to-person spread, and it now has a worldwide spread of the virus. So those are the 3 criteria of a pandemic. In that regard, we can still further look at the risk assessment per populations. So for most folks at this point, there is not an immediate risk of being exposed to the virus that causes COVID-19. That risk is currently thought to be low. There's not widespread circulation in most communities in the U.S. People who live in places where there is an ongoing community spread of the virus, like in Tampa or Washington, D.C., or areas of California, have been reported to be at an elevated risk of that exposure, and that risk increases dependent upon your location and your proximity to those local communities. The healthcare workers who are caring for patients with COVID-19 are obviously at an elevated risk of exposure. People who have close contact to persons who have COVID-19 are also at an elevated exposure risk, as well as travelers who are returning from affected international locations. And we already discussed which locations those are and what specifically to do in those cases. So, the CDC has also developed guidance to help in the risk assessment management of folks who have potential exposure to COVID-19. If you think you may have been exposed, you can check with that online. I'm still going to give you the TLDR version of it though. So there are a few risk categories the CDC has assigned now, and those range from no identifiable risk, low risk, medium risk, and high risk. So what are these? No identifiable risk means that any interactions with a person who is symptomatic of lab-confirmed COVID-19 don't meet any of the high, medium, or low risk conditions like walking by the person or being briefly in the same room with someone. Low risk means that you were in the same indoor environment like a classroom, a waiting room with someone who is symptomatic of lab-confirmed COVID-19 for a prolonged period of time, but you did not meet the definition of close contact, which is within that 6 feet. For medium, that means close contact with a person who was symptomatic of lab-confirmed COVID-19. If you were on an aircraft and seated within 6 feet of someone who had the COVID-19 infection, that means about 2 seats in each direction. So 2 seats to the left of you, to the right of you, front of you, behind you. So 2 meters if you are more comfortable with the metric system. Medium also includes living in the same household as someone, or being the intimate partner of someone, or caring for someone in a non-healthcare setting, just like your partner gets sick and gets COVID-19 and has it at home and you're caring for them, then you have a medium risk if you consistently use the recommended precautions for home care and home isolation. So staying home for those 14 days after you're returning from travel and just checking on the CDC's updated information on their website. If you go to their site, they are the experts in epidemiology and all of these diseases. They are going to be able to tell you what you should and should not do. For a high risk, that means that you have been living in the same household as, or being an intimate partner of, or caring for someone like at home for a person who has a symptomatic lab-confirmed COVID-19 infection without using the recommended precautions for home care and home isolation. So even if you are in the same household as someone who has a lab-confirmed COVID-19 infection and they are showing symptoms of it, if you use the recommended precautions, you're still only at a medium risk. So it's okay. You do not have to necessarily panic about this. We are just going to use these precautions and go from there. But make sure that when you are using precautions, that you're using them from an appropriate source. The CDC are experts on this. You do not want to be trying to supplement everything with clove oil right now. It is important to make sure that we are doing what we need to be doing. And Harvard Health has also issued a warning about that, about being careful where you're getting your news about the coronavirus. There's a ton of misinformation out there, and some of it has said that oregano oil is effective in fighting coronavirus. That is not a founded claim. There has also been a hoax saying the U.S. government created and patented a vaccine for it years ago, and like 5,000 people on Facebook have shared that. There's also a claim that coronavirus is a human-made virus in the laboratory. There are also folks selling essentially snake oil, non-medical immune boosters to help you ward off COVID-19. Other folks are saying that you can just take vitamin C and avoid spicy foods, or modify your diet by avoiding cold drinks or milkshakes or ice cream. That last one is an old video that's many years old and demonstrates the removal of a parasitic worm from a person's lips. So that original video had nothing to even do with COVID-19. It came out way before COVID-19 was even a known disease. So there is just rampant misinformation out there right now, guys. Don't be getting all of your information from Facebook. Go and check the CDC sites, check the WHO, and check Johns Hopkins website for the most up-to-date info. Even Harvard Health is saying this is where you should definitely go. The CDC and WHO have recently added Mythbusters pages to their information on COVID-19. They are not promoting or selling a product related to the information provided, and they are studying these issues scientifically. So there is a time and a place for essential oils, but there's also, I believe, a time and a place for listening to Western scientists, and one of those times is now. It's like how Dr. Semmelweis used to tell folks that we should wash our hands before we went between the morgue and the OBGYN wards. And no one really believed him at that point. And all of these children and these women kept dying. And now we have hand washing protocols for doctors who are touching anyone at this point. It's not just for surgery or for people having babies. It is now at the point where we all need to wash our hands. A lot of times folks are very reluctant when it comes to picking up new information, particularly as it relates to Western medicine, but there's a time and place for it. At this time, the CDC does not recommend testing or symptom monitoring or special management of folks who've been exposed to folks who are asymptomatic and have had potential exposures to SARS-CoV-2. So that means if you have, a contact of contacts, like a friend of a friend has had it or something, and they're not, your friend, the intermediary friend, is not symptomatic, then you do not need to be considered as exposed to SARS-CoV-2. You don't need to be concerned about it at that point. The risk level for that is also on a scale of no identifiable risk to high risk, just like the risk levels for symptomatic folks. So if you're asymptomatic but have tested positive for COVID-19, they'll likely quarantine you if you're high risk at that point, and that may be voluntary or under public health orders in a location that's determined by the public health authorities. You can't be doing any public activities. There'll be daily active monitoring if possible based on local priorities and controlled travel. Now, if at any point you change from asymptomatic to symptomatic, then the management for your treatment is going to be changed to the symptomatic category. Your risk level will not change, but the management steps will. If you go from high risk, asymptomatic to symptomatic, then they'll immediately isolate you with consideration of public health orders. The public health assessment to determine the need for medical evaluation will be conducted. If there is a medical evaluation warranted, they'll give you some diagnostic testing. If the medical evaluation is needed, it has to occur with pre-notification to the receiving hospital and EMS. And if the EMS transport is indicated, they will make all recommended infection control precautions. And they may also select for controlled travel. Air travel only via air medical transport. Local travel is only allowed by medical transport like an ambulance or a private vehicle while the symptomatic person is wearing a face mask. If you're at medium risk and you've tested positive but are asymptomatic, then they may recommend that you remain at home or in a comparable setting. If you have that, they will say practice social distancing. They may actively need to monitor you, and they may recommend that you postpone long-distance travel on commercial lines. So that means airlines, buses, trains, etc. Stay off of public transport long distance. If you move into medium risk and being symptomatic, then that'll just be self-isolation. Public health assessments may be conducted to determine if you need more medical evaluation. And then again, it will follow the procedures that we discussed earlier for medical evaluation, needing to pre-notify the hospital you're going to and the EMS transport if that's indicated, and only travel via air via medical transport. If you are low risk, then that means you're going to have no restriction on your movement and just self-observation as long as you're asymptomatic. If you start having symptoms, then self-isolation, social distancing, call your healthcare provider to determine if you need a medical evaluation. Do not necessarily go in. Remember, call them first. If they say yes, then that is going to be guided by doctors, and the diagnostic testing for COVID-19 will follow the CDC's recommendations. And you should also postpone traveling on any public transport. So again, buses, planes, trains, etc., until you're no longer symptomatic. If you have tested positive and you have no risk of being asymptomatic, you're fine. You have no identifiable risk at that point. If you become symptomatic, then again, self-isolation, social distancing. Make sure you're seeking health advice to determine if medical evaluation is needed by calling your doctor, and then that will go through the regular process of notifying everyone who needs to be notified and postpone traveling on public transit. That's about it for that. Now, the public health management recommendations made by the CDC that I just listed are primarily intended for areas that do not have sustained community transmission. If you have sustained community transmission, then you should be following the ones for your local area. That may be different depending on where you are, especially if you are in a place that has a high level of community spread. All right, we're going to go on another break, and when we come back, we are going to talk about how to tell the difference between allergies, the flu, and coronavirus.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America's Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America's Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America's Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Coronavirus and the management of people exposed to COVID-19 who are asymptomatic versus if they change to being symptomatic dependent upon their risk level. Now we're going to go ahead and discuss whether you can tell the difference between allergies, the flu, and coronavirus. And I'm just trying to give you guys as much information as possible from these reputable sources so that you can make the best decisions for your own health. So, the coronavirus has infected over 100,000 people worldwide so far as of March 11th. And a lot of events have been canceled. South by Southwest in Austin was canceled. And they've also banned any large public assemblies between now and May 1st. There have been a lot of empty flights. I'm sure you guys have seen how cheap a lot of these flights are right now. And it can be rather tempting. Just make sure that you are making the best decisions for your own personal health and that of those around you when it comes to where you're traveling and so on and so forth. We discussed the specifics of the travel recommendations from the CDC earlier to help guide you in making those decisions. We don't want folks to get too nervous about hearing other people cough or getting a little tickle in your throat, though. So it's also flu season. It's not just coronavirus that we're dealing with. There's also allergies. Spring is in the air. So we have a couple of different issues that we could be having if we start experiencing respiratory illness. You might be wondering if your stuffy nose could be coronavirus. So Dr. Greg Poland was consulted by CNN to discuss that. He's a professor of medicine and infectious diseases at the Mayo Clinic and also the director of the Mayo Clinic's Vaccine Research Group. And they talked to him about the differences between just regular allergy symptoms, cold, flu symptoms, and symptoms associated with coronavirus. So, cold or allergies are going to be if you have itchy eyes, a stuffy nose, sneezing. So that's just your classic, is it cold or am I having cedar allergies if you're in Texas, or hay fever. So that's going to be cold or allergies, itchy eyes, stuffy nose, sneezing. For flu versus coronavirus, do you have a fever? Do you have fatigue, body aches, cough, or worsening symptoms? So when you think that you should be getting better, you're getting worse. So that could be the flu or it could be coronavirus. However, if you're specifically getting shortness of breath, you're having trouble catching your breath, or you have recently traveled and used public transit, and if you have recently had any type of exposure to someone who may have been symptomatic for COVID-19, then you were more likely to have coronavirus. So we can kind of weed these out via the symptoms. Shortness of breath, that's going to be your big one, and you should generally speak with a physician if you are having shortness of breath. You'd want to make sure that you go ahead and call into your doctor. If it is an emergency, definitely still go to the ER, but you may want to call in yourself if you're able to. I understand it's shortness of breath, so you may be having difficulty, or have a loved one notify them that you are on your way in with shortness of breath and that you have recently had symptoms that are related to either the flu or coronavirus, so that fever, fatigue, body aches, cough, or worsening symptoms, and or if you have recently been traveling or been exposed to someone who has been diagnosed with symptomatic coronavirus. Symptoms vary from person to person. Risk levels also vary from person to person. Always check with your doctor in that regard. The main difference between allergies and colds versus coronavirus and flu symptoms is that the allergies and the colds tend to be affecting your eyes and nose, right? So it's a head cold. And if you also get a rash with it though, then speak with your doctor. Now with coronavirus and the flu, it tends to affect your whole body. That's why you're having these body aches. It's a systemic issue. It's affecting multiple body systems. It is system-wide. So you're having a fever and you're having body aches, but you're also coughing and you're having respiratory issues on top of it. It's not just like a head cold where it's just your eyes are watering and your nose is runny or stuffed up. So keep that in mind. With the flu and the coronavirus, you probably won't have a runny nose, but what you may have is a sore throat, fever, shortness of breath, and or a cough. So the differences between the flu and the coronavirus are very subtle in their symptoms. So just pay attention to your temperature. Allergies are very unlikely to result in a fever, and they typically do not cause shortness of breath unless you have something already like asthma that you've previously been diagnosed with. Allergy symptoms are usually regularly occurring and usually mild, so you've probably recognized that you've had these allergies before, and this is something that typically happens. Coronavirus and flu can knock you on your rear, though, so they say that you'll feel so tired and achy that you're going to have a hard time doing much other than wanting to be in bed. Everyone should be able to tell the difference in their general health in that regard, as long as you are normally a healthy person who does not have these other immune issues. Allergies can make you kind of tired, but they should not be causing that widespread knocked on your butt feeling that's also accompanied by joint pain or muscle aches. So usually cold and mild flu symptoms will resolve themselves and you'll start feeling better within a few days if you are otherwise healthy. However, if you are elderly or you have other health conditions, then even mild illnesses may take longer to pass for you in general. So this may take a little bit longer for you too. Coronavirus and acute flu symptoms get worse over time. So if you've ever had a nasty case of the flu, you might get worse when you expect to get better. I had that last year and it pretty much went into pneumonia levels and it was not great. I had to seek medical care for that. I also could not stop throwing up at the time, so they had to give me medication for that. If you're having symptoms like that, call your doctor. If you think that you may have coronavirus, that's really going to be if you're having shortness of breath. You can get pneumonia from the flu, and it look very similar to that of coronavirus, but either way, you need to go seek medical attention if you're having that shortness of breath. It could just be pneumonia from the flu, it could just be a secondary infection, but it could also be coronavirus if you are having shortness of breath. The early symptoms of colds, flus, and coronavirus can be similar though, and some coronavirus and flu cases can be really mild. That's why it's important to make sure we are mindful of our symptoms and see how long that they're lasting. If it is taking you longer than normal to feel better, then you may want to call in and speak with your doctor, especially if you're feeling worse when you think you should be feeling better. Remember, you know your body better than anyone. You're the one who is in it 24/7 and you are intimately familiar with its aches and pains and what feels normal and what doesn't feel normal to you. So if you're getting to the point where you're like, hey, I feel like normally I get better with the flu within 3 days or so, or if you're normally like an 8-day person, but it is persisting far longer than that, or you feel it's worsening, or you're having shortness of breath, listen to your body, trust your instincts, and call your doctor first. They will be very glad to hear from you. You're not going to annoy them or anything by calling in. They would much rather be able to help contain this and help you at the same time. We're going to go in another break, and when we come back, we're going to talk about washing our hands with soap and water versus hand sanitizer and some of the numbers from these global cases.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
The difference between the cold, the flu, allergies, and coronavirus. So now that we have that covered and we understand the general guidelines and when to call our doctor or to go to the ER and call ahead if we're having shortness of breath symptoms that are distressing. We are going to proceed with the rest of the precautions. So for hand washing, washing your hands is going to save people's lives. It's very underrated how much you can stop the spread of different types of microbes by washing your hands with soap and water. You want to use soap and water in particular whenever possible because hand washing is going to reduce the amounts of all types of germs and chemicals on your hands. It is not the same to just use hand sanitizer. If you are out and about and you don't have access to washing your hands with soap and water, then by all means, hand sanitizer may be better than nothing, but you want to prefer soap and water over hand sanitizer whenever possible. If you're going to use hand sanitizer, remember it needs to have a minimum of 60% alcohol content in it to help you avoid getting sick or spreading germs to other people. 95% is the cap of where you're going for that. So anywhere between 60% and 95% alcohol is the sweet spot. Anything lower than 60% and you might as well essentially just be spitting on your hands. Doctors and scientists have performed a number of studies on this over the years. We studied it in my microbiology class in college before I changed my majors. I was a pre-med student and we were looking at how different hand washing methods really affected the amount of microbes in some situations. So when we did this, you do some hand washing with just hand sanitizer and you're streaking your hands on the agar plate, so the little petri dish, essentially. And then you are marking on the bottom of it exactly what went on with that. You're going to do one where you wash your hands with soap and water. You're going to do one where you just wash your hands with water. And you keep track of the amount of time that you're doing these things. You go ahead and streak the plate without washing your hands. There's a lot that goes into it. It sounds super simple, but you're also checking for the growth of these microbes as you incubate them as well. So you can encourage more rapid incubation by putting them in a warm, kind of moist environment in a lot of cases to make them grow faster and study them. So we did that, and we found that soap and water are more effective than hand sanitizers at removing several different types of germs, like norovirus, cryptosporidium, and Clostridium difficile, and that alcohol-based hand sanitizers can inactivate several types of microbes very effectively if you use it correctly, but a lot of folks don't use a large enough amount of hand sanitizers, or they might wipe it off before it has dried on their hands. So they've done this study multiple times. This has been studied in several different places and been published widely in peer-reviewed research. We want to make sure that those findings that we found in my microbiology class 10 years ago are being disseminated to the public. We didn't publish a study, but rather we found the same thing in that simple class exercise that these researchers have been discovering for years. So hand sanitizers are not the end-all, be-all for making sure that we are staying safe. Hand sanitizers might not be as effective if your hands are visibly dirty or greasy. So hand sanitizers work well in clinical settings like hospitals where hands come into contact with germs a lot, but they're not typically really dirty per se. So it's going to work differently and be less effective in like a mechanic shop where your hands are dirty and very greasy versus being in a hospital where your hands tend to look clean, but you may be coming in contact with more germs. Other studies have shown that hand sanitizers work well against certain types of germs on kind of dirty hands, but hands that may be very greasy or soiled in community settings, so like if you're doing food handling. I remember when I worked in the campus cafe in college, and I swear that French fry grease got into my hair and my clothes and my skin all the time. Even if you can't necessarily see it, they may still be pretty greasy. So hand sanitizers may not work as well there. Hand washing and soap is going to be the recommendation for that. Hand sanitizers also might not remove harmful chemicals like pesticides or heavy metals from your hands. If you've touched harmful chemicals, wash carefully with soap and water or as directed by a poison control center. Several studies have been conducted and they found that folks who use hand sanitizer to clean their hands primarily have an increased level of pesticides in their bodies. So they're trying to get the germs off, but the pesticides and other chemicals are not coming off. So hand sanitizer alone is not enough. If soap and water aren't available, use a sanitizer that has at least 60% alcohol, because 60 to 90% alcohol concentration hand sanitizers are more effective at killing germs than the kinds that have a lower alcohol concentration or non-alcohol based hand sanitizers. They may not work equally well for many types of germs if it's under 60%, and it may just reduce the growth of the germs rather than killing them. If you're using a hand sanitizer, the correct way to do it is to apply the product to the palm of one hand. The label will tell you the correct amount, and then rub it all over the surfaces of your hands until your hands are dry. So I see a lot of people use it and they just pour a glob into their hands and it's either not enough and so it doesn't totally get all over their hands, or they pour a bunch and then just briefly wipe their hands together and then shake them like they're shaking water off of them. That's not how you do it. You have to keep rubbing the product all over the surfaces of your hands till your hands are dry. The steps for that are based on a procedure recommended by the CDC. You want to cover all surfaces of both hands with hand sanitizer, and that will give you a similar disinfection effectiveness as just rubbing in the hand sanitizer into your hands completely. So choose one and or both of those. You should definitely be covering all surfaces of both hands, but also keep rubbing it all over your hands until your hands are dry. Do not shake off the excess hand sanitizer. Don't rub it on your clothes or anything like that either. The alcohol needs to dry on there. You're trying to get it to dry and evaporate. Now, swallowing alcohol-based hand sanitizers can give you alcohol poisoning. You do not want to do that. And it's going to take a couple of mouthfuls to do it. It's going to take more than a couple of mouthfuls. So be cautious about it. Keep it out of the reach of the munchkins. If they swallow these hand sanitizers, that can really harm them. Not only are their bodies smaller, so they need less of a concentration, but, you know, at the rate that people are buying these hand sanitizers right now, put them up somewhere safe, moms and dads, so that the kids cannot reach them, especially if they're scented or really brightly colorful. The kids might think that they're something they're not. I think all of us have eaten weird things when we were kids, like paper and stuff like that. Our parents have told us about sticking beans up our noses. So you never know what a kid is going to do. Just keep it put up. And you can also get child-resistant caps for hand sanitizer-related products. Older children and adults might purposely swallow it to become drunk. Don't do that. It's not going to work out that way for you, and it's just going to make you very, very sick. So now that we know the differences between when to use hand sanitizer and when to wash our hands, and that we should always wash our hands, also keep in mind that if your hands are prone to being dry, so if you have drier skin or you're using excessive amounts of alcohol, remember that alcohol can be very drying. You know that you get headaches and hangovers if you drink too much. You get cotton mouth and your skin can feel really gross and dry. Think about that with alcohol on the outside of your body as well. One of the ways that microbes get into your body is through any other cracks as well. So if you have any cuts or any cracks, make sure that you are keeping those clean and closed off. If you have those on your hands, you may also want to avoid using more alcohol-related hand sanitizer. And remember that only alcohol-related hand sanitizer is going to be effective here. So it's either use that or wash your hands with soap and water. I highly recommend washing your hands with soap and water, just like the CDC does, so that you do not dry out your hands and cause any micro cracks that are then going to be more vulnerable to any type of microbes. I'm not saying that you're going to get coronavirus through a crack in your hands, but what I am saying is that it's cold and flu season, you guys, and we need to give our bodies our best shots. Once your immune system is already under attack by a different type of microbe, it can be really easy to get another type of secondary infection. That's why some folks tend to get pneumonia if they are already having respiratory distress from the flu or like with coronavirus. You want to make sure that you're not getting additional infections by not being mindful about how you're washing your hands. Make sure you moisturize. It's not just good for how your skin looks, it's good for how it feels. And nobody wants wind-chapped hands or alcohol-chapped hands right now on top of the cold or allergies or flu or coronavirus. So just as a general recommendation, don't be overusing the hand sanitizer. Wash your hands with soap and water whenever you can, especially if you are sick and you have coughed or sneezed into a tissue. Do that into the tissue or into the corner of your elbow, but if you're doing this into a tissue specifically, then you should in particular wash your hands after you dispose of the tissue. You want to make sure that you are not spreading this anywhere if you can at all avoid it. Lastly, if you'd like to check out that Johns Hopkins ArcGIS page, you can go and search for Johns Hopkins coronavirus online, and it will pull up the coronavirus COVID-19 global cases by the Center for Systems Science and Engineering. It will tell you how many total confirmed cases globally, as well as broken down by country, and then also break down for you how many total deaths by country, as well as globally, and the same for total recovered. It has charts and graphs if you are more interested in visual representation, and can show you cumulative confirmed cases versus active cases, so you can see visually as well where it's shrinking and growing. I think it's a very excellent tool, and it allows you to take a look at the raw data for yourself. I hope this has been informative for everyone and that you feel a little more empowered in having the knowledge of what this disease is, where we are currently at with it on March 11th, 2020, and how we should proceed accordingly. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please remember to subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.